3, 2, 1. Adam Hutchison, you are the MD of Belmont Healthcare, the Vice Chair of the Kent Care Alliance, an author and one of the trustees of the Care Workers Charity. It's an absolute pleasure. Welcome to the Care Home Show.
Thanks for the invitation, Simon. We're excited to be here and have a chat with you.
My absolute pleasure. Okay, so let's start at the top. How did you get into running a care home business? Where did it all start for you?
Well, strangely enough, it was, as most tend to be, family connection. So father was used to run care homes, but sort of very old school contemporary buildings. He had a couple, lifestyle business to a degree. I was in the telecommunications sector and had a business, sold it. He asked me to come and do the same thing for him. And that's when my eyes were open to the world of adult social care and fell in love with it, if I want the truth. Yeah, that's where I started. Actually, one of those care homes is still in our portfolio.
Oh, that's
so it's
exciting.
kind of a bit nostalgic that it's still there, you know. But
I can imagine that having come from telecoms and then entering into healthcare, that must have been somewhat of a baptism of fire in many ways, because obviously there are some principles that are probably similar, but it's very much a different business model. How did that work out for you?
That's a good question. At first, I thought it was going to be really difficult because I wasn't expecting to come in to actually operate. I was coming in to help sort of flush the business and then sort of sell it on, essentially. Well, in terms of my father was looking to retire and he wanted to get it, wanted to get the portfolio for somebody else to pick it up, really. But I think when you get into it and you realise that A, there's some amazing things being done, and B, actually businesses have got to be of a certain standard to be able to sell, and I think maybe it wasn't. If I'm honest, and what we did is when I got involved, there were some absolute synergies with what I was doing before, especially because a lot of what I did in telecoms was based around call centres. So you had a similar sort of synergy with sort of staff retention, recruitment issues. And as you kindly pointed out before, I am an author. I've got a book that talks very much about that interaction between employees and employers. So there was real synergy between this sort of idea of sort of shift work, shift patterns. Low paid is a word that used to be used, but not necessarily something that I believe in, which is hopefully something we'll get onto today. So there was some real synergy between that sort of recruitment and retention piece. So actually I found that bit quite easy. The difference was not having to wear a three-piece suit and a tie to work anymore, which I quite actually enjoyed. And then, you know, it's multifaceted, brought in sort of property, marketing, you know, development stuff. So it became actually quite a nice fit, but not something that I ever felt that I would end up being in.
It must have been quite interesting then, coming in to effectively take over your dad's business, to prepare it for sale and then exit it in whatever capacity that might have looked like. At some point, you must have fallen in love with it and thought, hang on a second, I don't want to get rid of this business. I want to go all in on that. Like, how did that come together?
It was pretty much instantaneous, if I was honest, okay. Because I wasn't really I was doing some consultancy work, some sort of business growth services in central London, and I was living in central London at the time. It was, and the particular parts of the portfolio, the properties are actually in Kent, so it's actually a nice little sort of journey. It was quite straightforward, and I started going and went in, and probably within a couple of months, it was like, okay, I really enjoy this. It was the challenge of it being something that needed to be sort of really improved and moved to the next level, and sort of some energy, I think, was the word that needed to go into it. You know, my father was in his late 50s, early 60s actually, early 60s, and he was kind of, you know, I don't think he felt that he knew that the landscape of the sector was changing, and I think there's that step. You either have to make a decision that you're going to go with it, or, you know, you've got to make a decision on whether you feel it's the right thing for you to continue to do, because the sector landscape is completely different to what it was a decade ago, and I think you have to be so much more focused and vigilant on the way in which you operate to be able to make sure that you're delivering effectively. Yeah, so I think it was quite kind of instantaneous. It was kind of, I was there for, like I said, a couple of months, and I was okay, yeah. This is something that I could see myself doing. I've always had this thing where it's like, if you go to bed on a Sunday and you don't want to get up on a Monday, don't do it.
Yeah.
And I've always been like that. Mm-hmm. And since this, I haven't really done that. And
what was it that caused almost that shift change in your mind to go from, right, this is going to be a I don't know, 6, 12, 18-month project of getting it sold. What was it specifically for you that made you think this is a bit of me, this is something that I can see myself getting involved in and making a positive impact with?
I felt because when I came in, it was at a point where, especially in the silo that I was in, it felt like it didn't make any sense in the way it was working. You know, I just saw these contemporary buildings that offered long-term residential care. I was kind of like, well, surely that's not the only thing it can do. You know, I essentially I'm a salesperson from old, and you just look at that funnel, is actually where can value be added? How can you increase number of incoming occupancy? Well, actually, you need to do different types of work rather than just focus on one area, because all you're going to do is dwindle lower yourself down. So it was all little things like that, really, where I started to think to myself, there's something else that can be done. So that was kind of like a little bit of a spark. I felt like, and I'd been in telecommunications for, I don't know, 12, 13, 14 years, and seen that sort of go through a change. And I didn't really know much about it, which I think was probably a good thing. I think it's one of the bonuses. I didn't really know a lot about it, so it meant that I could come in and just go, well, I think it should be done like this. People have told me that no, it shouldn't, but I'm hopefully that I'm still continuing to do how I think it was going to be done.
There's two really interesting things about what you've just said there. You automatically walked in and saw an opportunity for a better model of running a care home business, which I think comes from having fresh eyes, and then also I guess there's a link in between the two, but then coming in with lots of energy, because I think there are all sorts of challenges that the sector are facing, and I think that it is required for the sector to step their game up, and I've always really enjoyed your philosophy of building a growing sustainable care home business. I think it's super important, and that's got you to where you are today. So give us a little bit of a breakdown on kind of how that's come together over the last few years for you then. And how long have you been running the portfolio for as well?
Well, I got involved probably 6.5 years ago, I'd say, 7 years ago, 2012, something like that, when I was getting involved. But again, it was kind of like a few days a week, full-time actually saying, no, this is what I'm going to do, and sort of exit any other real interests that were taking my mindset away from it was sort of early 2015. So not that long, really, 3.5, 4 years, I'd say. And that was when we sort of set out a plan of how we wanted to go about it. So it came with me, well, I suppose it's similar to how you would do it, having, the fact that we know each other from the sector, is that you have to establish yourself and understand actually what the sector's doing. So hence why I ended up being involved in the Kent Care Alliance, which was the Kent Care Homes Association. I thought getting involved with the trade association network, get to meet people, get to understand it, do a bit of networking, and things have kind of grown from there. And as you go through, you meet different people, and then if you have the same philosophy, the same desires, it's then sort of structured its way through. And I suppose I've always had a little bit of an opinion. And I think maybe the sector, it feels like it has now, but when I came into it 7 years ago, like I said, I think there was probably things happening, but there wasn't a network like there is now. Which doesn't feel, or maybe I just wasn't part of it, but it didn't feel like there was. There feels like there's a lot more energy in the sector, and a lot more ideas that aren't siloed. I think people are actually promoting a lot more in the things they're doing, and I think that can only bring good things. I've seen a lot more of that in the last few years.
I'd say so. Again, I've been in this sector roughly half as long as you have, but even in the time that I've been involved in the sector, I've seen quite a big shift change in opportunities for collaboration, for people to come together within the sector and break down some of those silos. I mean, that was part of my reason for wanting to start the podcast. So you and I have these conversations about the sector, talking about the challenges, the opportunities, the innovations, all of that type of good stuff, to be able to have a platform where, when we have an energetic conversation about important things that are happening in the sector, to be able to make them freely available to people, so that they can log in, listen in, and do. Our intention was to educate, inform, and to inspire people. Hopefully there's a little bit of that going on, and that's kind of our contribution and our way of being able to go and do that. But there's an awful lot of other initiatives as well going on around the country, and it's good to see, because it feels like there's a positive energy and a more positive narrative about the sector, both externally from outside the sector and also within. It's not to say that obviously there aren't some horror stories out there. Of course there are.
But I think it's a really important point you make there, is that actually I think one of the key things that we need to do is and I've been talking about for some time, and I think a lot of people are also doing that now, is that we have to focus on almost, it's an education piece for the wider public. There's amazing stories going on in care all the time. Going back to what you said, why did I want to do this? I think there was almost a moment I was humble that I came into it, and I saw amazing work being done within the care environments by people, and just making somebody else's life better. That's what they do. They get up in the morning, they come to work to make somebody else's life better. That's kind of their primary objective, and it's really humbling when you come from a totally external, especially sales focused environment, targets, all that sort of stuff, and then go, oh, okay, yeah, okay, this is much more important. And I think that was one of the reasons that there was that synergy. It felt like, okay, I wanted to try and do something because I felt like there was not enough being done.
It's interesting. You've come from a telco background, I've come from a technology background. The way that I've always described it is, although I did well in my career and I enjoyed it to an extent, there was no emotional payoff. So I'd do a deal and it would be great in some way, shape or form, but I had no emotional connection to what I was doing. So you talk about that, the feeling on a Sunday night, like if you've got the horrors on Sunday night, or you wake up on Monday morning and you can't be asked to drag your behind out of bed type set of circumstances, that's the world telling you that you're not doing the right thing. So you then go and connect with a sector where you've got those types of really positive things that are making a difference in people's life. It feels good. It feels good. I know when I do a deal, I know good things are going to happen. That transcends us as an organisation just providing a service. That means that hopefully we're doing our little bit to turn the dial up on the sector.
Yeah. And I think it is happening, like I said, in silos, but making it more mainstream will be really positive. And then going back to what I was saying about that education piece, there's so much bad press, and people are always banging on about the problems. And yet, absolutely, there is going to be, because it's emotive, it's about human beings, it's about vulnerable people in vulnerable situations. But actually, the bad stories are few and far between, and there has to be some rationale. And it's easy to promote the bad story. And what we always do is all of these amazing things that happen in the sector don't end up in the public domain. They end up in our own media, as in the sector media, which means we all hear about it. Yeah. But then actually, the people making decisions about it don't. I think if somebody ever asked me what would be the one thing that once you're done, and you could say, if I could just get to a point where people go, yes, I want that type of care, because they have the access to make that decision, I feel like, okay, we've made a difference, we've done something different, because people don't. They're led by, the decisions that they make are led by people who aren't necessarily leading them in the right way. Private funders don't necessarily know where to get the information. And certainly anything that's funded by health or local authority is not given, now we're getting into some deep stuff, it's not actually told about by any, they're not given any sort of real guidance on where they should be going and the decisions that they should be making. And that's because the wider public is constantly, focusing on. It's interesting, isn't it? Recently we've had these horrific panorama shows. Oh, amazing, just come out just as we're starting to complain about the Green Paper not coming out. Yeah. What perfect timing that seems to be, And again, one of the things that I find really frustrating is CQC. Not the CQC in general, because I think it's absolutely there for the right reasons. I mean, the CQC in terms of, so now it's mandatory that they send a report to the local press. Well, okay, I get that. It's trying to keep people honest. But sometimes I don't know whether that's the most effective use, because it
feels like a threat.
Yeah, but you don't see many outstanding. We have to push to get our outstanding care homes in the press. We have to push to get our good care homes in the press. If you have a bad issue and it comes out, it's there. But everybody knows you can read a requires an improvement report, and actually, there's some really amazing things in there, but it's not helpful to then allow you to then step to the next level. You're almost sort of like shot across the bow immediately. You're stopping people from being able to market. You're maybe stopping people being admitted, and then you end up on a circle of where people are chasing their tail. So I think there's a wider collaborative piece that I don't necessarily know that's happening. And I suppose that's going back to things like this. It's about trying to get people in the wider public to understand it's their services. It's their service. You are the ones that are able to access that. And the more information and the more guidance that we can put in the wider public domain for them to allow to make the right decisions about the right type of care, I think the better all of us are going to be. Because there is a choice that the country has made to make care virtually ran by the private sector. Whether you like it or not, it's virtually run by the private sector. Therefore, why is it that the public aren't allowed really to make the decision on where they go? It doesn't make any sense. So, like I said, we're probably getting a bit grandioso, but that's kind of where I think that we need to make an impact, and I think that will have positive strands onto everything that we try and deliver as an outcome.
Mm-hmm. So you wrote an article called the postcode lottery.
Yes, a recent one.
Absolutely. Yeah. Give us a little breakdown on that.
Oh well, now we're going into ground, aren't we? Thanks for that. That was a leading one, wasn't it? I've kind of shot in early here, haven't I? Without saying, we've got you could have the standard route that we could have interview gone, and then now we've gone. Let's try and make some interesting points. Yeah, I did. I wrote an article about postcode lottery. Mainly because I was frustrated with the fact that certain incidents had happened locally where some of my care lodges, care homes are set. And it really frustrated me. And I kind of felt it was unfair because essentially a number of residents, more than a handful, had been relocated from one of my care homes over price. And it really frustrated me, so we went back to the local authority and sort of commented and said, look, hang on a minute, we're not, there's various reasons behind, hang on, why are you moving people? And I just don't believe in the way in which it was done, especially because it wasn't anything untoward. We hadn't changed our prices, they just decided, well, you're too expensive, even though we were delivering based on assessed needs. And so then I've got a plethora of data which I've used in the past for articles to try and be factually correct, because I think going into a meeting and sort of verbatim and just talking rhetoric doesn't help. In this industry, you have to go, this is why I've got this opinion. I kind of just thought, well, I'm just going to release an article that talks about it, because what I can't understand is that, totally cynically, if I knew that I was going to have state-run care and I knew that could be a probability in the next sort of 10 to 15 years, but I knew that I couldn't afford it, I would move house now. I would go, well, I'm going to live in one of those counties because one of those counties are more likely to spend money on care that I want to live in. Yeah. So, you look at Somerset and you look at Northwest Bristol district councils, they increased their care delivery fees by over 22% in the last 12 months. So that is an uplift based on the fact that was their market, that was market driven for them to access the type of care that they felt that the community needed. Yet in other areas, it's been between 1% and 3%, and it's still way below what it costs you to deliver it. And I just think to myself, well, it doesn't make any sense. But then you look at the Scottish model, and the Scottish model is across the entire country, it's one fee. So yes, we're getting into fee ground, and it's not, I've always been an advocate of not arguing fee, but demonstrating need. But I think there comes a point where you've got to say, well, why is it that we're not allowed to inform the public that, you do realise if you live there and you're going to be more likely to pay for your care, that you're not going to be able to have access to what the sector believes it's costing now to deliver it. And I just think that was something that people should be allowed to know. So that's why I wrote an article on it, which clearly evidenced that that's the case.
It comes back to choice, though, doesn't it, for the soon-to-be resident? Ultimately, the idea, it's set up in a way where future residents are meant to have choice, and it doesn't appear that they have, or at least that it's going to be limited by the funding options that they're presented with. So it's kind of almost they're not living by their own philosophy, and that's, it creates more issues than we probably have time to be able to go and even break down in this conversation.
But I think there's a point I need to just sort of caveat that almost, is that I also think that there's a responsibility for making sure that we understand that as all social care and the delivery of social care post healthcare outside of the wider healthcare piece, it's always that deliberation between actually we have to come to a clear understanding that sometimes maybe everything isn't free. And it's nothing is free. It's just that synergy, because they feel it's healthcare, it's care, it's support of individuals, that I think sometimes we have to be a little bit clearer on cost of versus delivery of. And I think that that's a much bigger discussion. But I think sometimes it's kind of a hidden. It's kind of like avoided the elephant in the room. Oh, by the way, we've got to pay for this. But
yeah, 100%.
So let's just talk about this. And I think we all know that there has to be a modicum of understanding between that are funding streams that access care. I think that's one of the reasons, going back to where I kind of see the future of care and the model of care needs to have multi-funded streams. It needs to have private, it needs to have NHS, it needs to have local authority. And that's why our business model is very clear in that, you know, we are open to multiple accesses to care. And like I said, if in a decade's time I can stand there and go, okay, I stuck to my guns and it worked, then that's where I think it's about building something for then and not now. And I think a lot of what's being done now, in my opinion, is for now. And, you know, I was watching a YouTube video recently. It's a Steve Jobs, one of his WWC events. I can't remember the exact when they released Apple, from 1997. So 22 years ago. And I've actually put the clip into a Disrupt the Market sort of talk that I do. And it's 22 years ago, and the stuff he's talking about in that is what we see now, but it took 22 years. And I know it's, again, delusions of grandeur maybe, but I just genuinely think that the things that we should be doing now aren't going to be what we're going to deliver now. And we've got to remember that you know, governments and healthcare is very short term. So if you, from a private business perspective, trying to affect impact on a socially and publicly funded arena, we need to just think outside and go, well, I'm just going to have to think about then and hope that when I want to go into care, that's what I want it to look at. So I'm just sticking to that's what I'm going to try and build. Hopefully it works. But we'll see. I'm probably just it's going to fall and I'll end up it not working. But I think at least if I stick to that, I'll feel like I've tried.
It's interesting because one of the things that, I mean, you alluded to it then, I think a lot of people don't necessarily have their head above the parapet. They're not looking out into the distance and trying to work out, okay, so what might this look like in the future? Because it doesn't look like the same that it did 2 years, 5 years, 10 years ago. And with so you've got funding streams, you've got technology, you've got life expectancy, you've got dementia care, you've got all of these things, all of these different dynamics that are ultimately going to change the game relevant to what happens within care. And there probably aren't that many there aren't as many conversations at the moment that there should be, that where people are thinking about how's this all going to work in the future.
I think there's lots of people that are talking about it, absolutely, and I think there's more conversations going on now. I don't necessarily know they're actually going to deliver anything in the future. So, but maybe they are, and, you know, hopefully people watching this can then go, no, you're wrong, Adam. And I hope so, because that's what I'd like. I'd love there to be comments made saying, no, you're wrong. Great, I'm wrong. Brilliant.
Absolutely.
Then tell me what's happening.
We can all learn from that, hopefully, by putting it in an open forum where people, again, it comes back to...
absolutely. Because, okay, when you go into when we have to access care, because there's a point that we're going to have to do that, wouldn't it be great that we knew that we could get everything from one place and we didn't have to keep going, and have no idea what's happening? You know, I can categorically state that we have families that we deal with now that literally come to us and have absolutely no idea. There's no education, there's nothing. They haven't got a clue, and then they've got to go to that person, this person, this. It just needs to be going, right, we just deliver it in this way. There's multiple people that are doing it, but it's delivered in this way. And that goes back to why we've been sort of so strong to sort of promote our vision and values across our business. You know, we actually tweaked them recently because we felt like that they weren't as clear as they needed to be, and I think that was a really important piece that we did, because it was trying to actually say that's what we want to do and make sure that everybody bought into that.
Getting that buy-in is really, really important. I think, okay, so I definitely want to come on to the vision and values in a second, but okay, so from the perspective of Belmont Healthcare, you're talking about providing people within the communities that your care homes serve and will serve, because I know you've got some big, bold growth plans for the future.
Yeah,
what does that look like? What are you doing to make sure that that's a reality for the communities that you're going to be serving it?
Well, I just think that I coined the phrase a mini STP. If anybody understands what an STP model is, they'll get where I'm coming from. There's kind of an 8-piece framework, and I think 6 of those 8 pieces can actually be delivered by a private, not-for-profit healthcare organisation. And I think that we have a responsibility to provide multiple forms of care. And one of the key parts of our vision and values is continuity. That's one of the key things in our 5 values as a business. And I believe that how great would it be, again, going back to the sales approach, you know, very business-minded but true, is creating a wider funnel. So rather than focusing on long-term, fixed nursing, you know, dementia, residential care, which actually, you know, A, people are becoming more and more complex when they're referred, and B, that window is so much smaller. So it's a constant, you're talking sort of 18 months worth of care, which is not great on the people that look after, it's not great in the families. It almost becomes that sort of hospice level care to a degree. Why don't we make the journey not easier, but more accessible, more achievable, and more understanding from a family's perspective, rather than it becoming sort of two levels of grief. So actually, if we can say, let's create this model. So we've tried to abolish the word care home in ours. We call all of our sites lodges, because what we're trying to say is that if you're going to come to us, we would like to work with you and understand what care is best. If you have an ability to be in your own home, then be in your own home. Whether you have dementia, Parkinson's, actually, how can we enable that as best possible? So what technologies can we look at to enable that? How can we reduce the pathway so that ideally, wouldn't it be great if somebody was coming, started to see early onsets of dementia in their sort of 50s, which we're seeing now, which actually falls outside CQC registration, would you believe, in a care home? Mad. But actually, we wanted to help support that person and that family. Well, let's support them in their own home, or maybe support them through daycare, or maybe support them through just community support and education and training. So that's a piece there. And then what happens when those needs get higher? Well, we'll give them more support, and then more support, and then it gets to a point where, well, actually, they now need long-term care, and then they can come into a lodge environment, whether that's respite, short-term, few months, longer, maybe a bit of rehab, step in, stop them going to hospital. It becomes a much more palatable journey than it does if you're going breakdown, emergency room. Now you're in a hospital environment. They need you out of that bed, and now it's a horrific decision making to get that person into care. Oh, nobody wants to fund it. Oh, horrible decision making. Oh, and then they end up in a care home we don't want them to be, and then it's all fractious. Well, how is that good for anybody?
There's so much stress and tension throughout that entire process.
It's bonkers. And that's what I just think is why the system's broken. And it's still broken because I don't see many. I spend a lot of time eyeing up the press and talking about this sector all the time, and I don't see many people doing that. And we don't do it from start to finish. We try to. What our plans is to, that's what I want to deliver. If somebody has an incident at home, I don't want them to phone 999. I want them to phone the local care lodge or community environment. We go out and check on them. Actually, how many of those people do you reckon we could stop from going to hospital? Do you know how much it costs? This is true facts. Do you know how much it costs for one person? If we stopped one person of every of the 168 hospitals in England from going into hospital, just one person a week, do you know how much it will save the NHS?
I don't, but I can imagine it would be
£16 million a year.
Figure.
And there's 4,500 A&E admissions per hospital per week. And we say we stop one. And predominantly, people over the age of 65 that end in hospital lose a certain amount of lifespan by ending up in hospital because it's the wrong place for them to be. Of course. So it's just, well, why can't we just find a better way of doing it? Let's be more reactive, more proactive rather than reactive. And I just think that why can't that person, we can go out and find, we're asked to do, if you ask any caring in the community provider, which we don't necessarily do a great deal of, but we're planning to as a business, is imagine how highly trained these people are within our care environments now. They have medication delivery, certain levels of things that they have to do, training, regulation, certification, all of this stuff. So you're saying that we can't make a realistic decision on whether a person in their own home needs to go into hospital. And even if it's only 1 in 40 that we stop dialing 999, that's still massive impact on our health system. But it just, in my head, it's simple. But maybe I'm just, I'm a simple Midlands lad who's just decided that I think that there's an opportunity. I just think, I can't understand why people just can't see that that's going to make so much more sense than, an ambulance having to come out to check on somebody that maybe actually we can sort that. Or actually, we could save that person's life because we, in the community, could be 6 miles away where an ambulance could be half an hour away, 40 minutes away. I just think that makes so much sense. But it's how we make sure that sort of pathway creates, and that's what I believe in. That's what our model is. I'm not afraid of talking about it. I want other people to do it. I'm never going to be big enough to be able to do it. So why? It's what these things are like. I talk about this sort of idea of care over and over and over again, and I think there's other people in a much stronger position and with opportunities to do it than I am. I'm a tiny fraction of the sector compared to others. I just think that's where. Doesn't that sound exciting to you? Wouldn't you want that?
Of course. I remember when I first entered into the sector, I remember thinking to myself, well, why isn't it done that way anyway? I think that's when we first met each other. I remember you explaining your model and me just thinking to myself, that just makes an awful lot of sense.
What, when somebody thought that you were me?
Oh yeah,
how we were first introduced.
Yeah, no, that was reasonably hilarious.
This is might get edited out, but it was quite funny that I actually had a 4 to 5 minute conversation with somebody that works for my tax advisor company and knew of me, where we'd met before, and he thought I was you. And we ended up talking to me as if I was you, asking me, really enjoyed your LinkedIn post today. And I'm like, I don't remember doing one today, but I can't remember what it was. And then I made it my effort to, at that event, to come and find you, because apparently we look the same. But I don't know whether we do. I don't think so.
The wonderful thing was the fact that I sat next to the gentleman in question, and no names, we won't shame him tonight.
No.
But yeah, no, he looked pretty embarrassed. I'm not going to lie. As soon as he told me, I was like, I've just been chatting to this guy. I thought it was you, and I think I've just made a bit of a silly person out of myself.
I let him go. I thought that I don't really want to. And he was talking a lot. I couldn't really stop him, so I let him go. But you've got the luxury of not having grey hair, so that's where you're definitely not me.
I'm hoping
definitely
the light isn't picking it up at the moment, but yeah, I'm getting a few more at the moment. But
oh dear, funny. Sorry, I thought that was quite an interesting anecdote. But it was good. But I actually would like to thank him. Because otherwise we wouldn't have met, and we know we've gone on a similar sort of journey with similar ideas. So it's actually we laugh now, but it was a good introduction to it.
It was a good introduction, and it makes for a good story as well, which just adds to it. So, okay, so there are probably going to be operators that are going to be watching this video, and they're going to be thinking to themselves, right, okay, that sounds great. Like, where do I even start? Because that's a big step change from where a lot of operators are today. There's a huge amount of operators that I see, and it's wonderful to see that their intent is good. Their understanding of how to get there sometimes is a little bit lacking, and that's something. If you could break that down just a little bit to kind of share some ideas around how, as a sector, as a kind of somebody that has a macro view on the sector, how can we make that possible?
You know, when you decided to do this, did you have any idea how you were going to do it?
Vaguely. I'm good at looking at really good at looking at the horizon and thinking to myself, right, okay, well that looks really appealing. I'd love to be able to get there, and then I kind of fumble along, and I'm lucky that I've got a really solid team that support me and helping good stuff happen. Yeah, that's kind of how it ended up coming together.
You just answered the question.
Right, okay, I've got it.
No, just because it's the same theory. The horizon is what we've just spent the last few moments talking about. That's the horizon. And yeah, I mean, we've tried and failed certain things. I think one of the biggest challenges that we've found is the fact that we're not big enough to be able to make the impact alone. Hence why I think it's just good to just say, this is what I think it should look like. And then maybe people can sanity check, because again, it's just a vision. We've tried to do it in certain ways and it hasn't worked. A lot of the problems have come around about regulation, about when we end up with like, how do we register to do these types of services. So, for example, we started a home care business that was supposed to run alongside, and we found actually having a completely separate satellite unit away from the home doesn't make any sense. So then the idea was, well, let's just make sure our homes are registered for multiple activities. But then it becomes a problem when the inspection turns up and maybe you haven't quite got to doing some of those yet, or you're not servicing that element of the registration just yet. Then they're like, well, why are you registered for this? And they come in trying to find all the paper. No, but this is a part of a new innovative service that we're trying to create, and they just don't get it.
You don't fit into the cookie cup
yeah,
model.
so then we end up getting challenged on that, and they're saying, well, you haven't got evidence that does. I say, yeah, because we haven't started it yet, but we need a registration. No. So that's been challenging, challenging to a point where, it nearly made me not want to do it, I'll be honest, and that's the downside of this industry. So again, it's all the fumble that you go through to get there. One of the things that I was clear is that the only way that I'm going to do it is I have to have a business that has strength, reputation, size and scalability to be able to make a statement to do it. And that comes with having a very strong growth vision and then finding somebody that wants to fund that growth vision, which has been the hardest thing for me, because it's one of the challenges of this sector in general. If you want, it's sadly, it's a horrible phrase to use, but it's asset rich. And to be able to drive it, you need assets that are delivering that model, and assets come with the fact that you have to fund them. And, they can't be funded by your own bank account, because these are, huge sums of money to be able to either build, buy, refurbish, transition, to be able to do that. So, and I think sometimes, that's where the challenge comes in. Again, I'll go back to this disruption talk that I do. I'm actually doing it next week at the Excel show, or might be post this by the time it's come out. And there's a slide within it which has a triangle, very straightforward, and it's got operators, local authority, healthcare, and slap bang in the middle there's a piggy bank. And it just says, but we also have to grasp an understanding from the funders to be able to go, okay, yeah, I want to back that, because that doesn't. You can't value engineer. You can't just present a forecast that says, because it's finger in the sky to a degree, because you could build it and it not work. I suppose you've just got to find somebody that's willing to back a vision, and you've got to almost build segments of it until you get to a point where you can go, okay, now I'm big enough to be able to say this is how we're going to do it. And I suppose that's been my biggest challenge, is I'm just not of a scale to be able to do it. To just literally go, this is how we're going to do it. I've just got to say, I'm going to embed that into everything that we do, and focus on the fact that it is, like you've said, that's where I want to be. And we'll go through a mire, and we're at the bottom of the bell curve at the moment. I've just got to make sure that we focus on getting to that in the end, or during this journey. I wouldn't say the end, because I don't know there is an end.
Yeah. It's ongoing
Did that
cycle,
answer?
of course. I think so, yeah. And I mean, look, we've kind of agreed that we're just going to carry on creating content together and things anyway. So this isn't that's not a finite conversation. This is something that we can talk about, the evolution of what's going on with the sector, what's going on within Belmont, how, and hopefully being in a position where we can try and to be able to support the sustainability of the sector to achieve some of the things that you're setting out to do, and other people's ideas and initiatives around how they can make other models work. Because again, it's not like we can sit here and go, oh well, this is absolutely fantastic, this is exactly the way that it's going to be. The sector needs new ideas. Well, sorry, I'll challenge my own thought process there. There's lots of good ideas, lots of people, more people need to go out there and start implementing stuff. Doing a process of testing, measuring things, making good stuff happen, because without a little bit of, let's call it positive disruption, we can't, I kind of never remember the analogy, but if you're standing still, you're basically moving backwards. You need to be making steps forwards. And there are so many opportunities to do so within the sector.
Absolutely, and you finished that when I talked about we sort of re-engage with our vision and values recently. One of our values, was innovative, but we actually changed that to disruptive.
Sure.
Because actually we felt that disruptive meant more to what we were trying to get to. Because, I don't necessarily know that we're that innovative in a way, because anything that involves innovation usually comes from support that we have from external. But disruptive, we are trying to do something differently. It don't necessarily means that means innovation. So I think we were trying to get a bit more focused with ourselves on that. So yeah, disruptive I think will make a big difference.
It's interesting. We didn't know this. Well, obviously we're pals anyway, but one of our values is also to be disruptive. Not disruptive. Some people sometimes say, "Oh, disruptive. That sounds a little bit." They take it in kind of a negative context, and it's not disruption for disruption's sake. It's a case of let's ask the question why. Let's challenge the status quo. Let's try and work out better models of operating. Let's look at technology. Let's look at funding systems. Let's look at ways in which we can help improve the quality of the policy of the
Which
sector.
almost like it's been about trying to create a movement, because you can get majority of people moving in the one way, then we're going to be, even if that means it's going to come off in different strands, but we're just not doing what we've always done.
Yeah.
Coin it, our phrase, do what you've always done, get what you've always got. It's kind of where we're at.
Yeah.
I think.
Yeah.
I don't think that there's anything absolutely amazing out there, though, or a pathway that people are just going, this is completely the way in which there's absolutely really cool stuff happening, but I don't, if it was, we wouldn't be in the position that we're in, whereby we're still seen by, the BBC and the wider media as being the people that don't do enough.
No, I completely agree.
Because we do. I think there was a good series on recently, wasn't there? There's 2 episodes, one where they did focus on the provider a bit more, and I felt like there was some actual some support for the operating of it, because it is the hard part. Operating's the hard part, and trying to operate effectively and to the right values. It's not an easy task.
It's interesting. People live out their life as part of a kind of a narrative, and the kind of the decisions and things that people make are part of kind of a narrative and the kind of the story that they live themselves kind of personally. And a lot of that's derived through the media, because we spend all this time kind of consuming information, and that might be good or that might be bad. Unfortunately, the way that the modern media basically works, bad news stories sell. It'd be nice to be able to alter that just a little bit as well. But I mean, quite how you do that when the mainstream media and kind of publishing and stuff like that, their margins are being eroded by digital. That's why media forms like this hopefully make all the distance. I don't know whether you saw in the Times there was an article about the podcasts. The disruption of podcasts, because it enables people to have open, honest, frank, long-form conversations, to be able to do just what we're doing now. Chew the fat on big old subjects where you haven't got to throw in a contentious headline to try and sell a newspaper. It's just a case of, if you want to get on board with our movement, if you want to make a difference in the sector, come and spend a little bit of time engaging with this type of content, because hopefully you might learn something that will make not just a difference in your business, it will support the sustainability of the sector and help ensure that vulnerable people get looked after properly.
And that's exactly, I haven't watched the news or read a newspaper for probably 5 or 6, 7 years maybe.
I refuse to.
Don't put it on. I don't really watch a great deal of television unless something's guided me to it from some sort of social content. Series and films to the side, but I mean, in terms of just like, obviously I source out a documentary, and this caring crisis, I think, is the program. It's a 2-part thing I did watch, but yeah, I just try and avoid it. I don't really see what value it adds, to be honest. I listen to a lot of podcasts though, and a lot of Audible books. It's what gets me through the travelling around the country.
Well, that's it. I've just realised I've contradicted myself, so I should explain. I've just said that I just saw an article in the Times and that I don't read newspapers. I just hasten to add that was text to me by a friend who was making a point. So just I wasn't sat there on Sunday just kind of looking on the breakfast table, drinking my cup of coffee and stuff like that, reading a newspaper. So yeah, I thought I should manage expectations, but. We said that we'd go into, we've touched upon it, but let's break down your kind of vision and values in a little bit more detail. So explain to people what's the kind of the positive change that you want to see in the world, and what do you envision for the sector?
Wow. Okay.
Not a big open question for you.
No, it's fine. I mean, our visions and values are very much coined around the two most important parts of what we do, and that's the people that we have within the organisation who actually deliver care, and then the people that come to receive the care. So we try and focus, and we try to make them very succinct in terms that we want to be caring, continuity, and compassionate. It's kind of those 3 C's are about the I hate the word service user that people use, but I've just used it. The people who receive care within our environment. And then we have understanding and disruptive. They're kind of like our 5. And the disruptive and understanding is actually about the people that we have within our group, because it's trying to be disruptive and get them to understand that I want you to come with us with ideas. I want you to tell us what we're doing wrong. I want you to tell you what you think we could do better. And understanding that actually it can be a really naff place to work sometimes. It's not easy. It's not an enjoyable job sometimes for people. And how can we make it as enjoyable as possible? So I kind of keep going on about this thing about how can we make care a cool place to work? There's some amazing people out there that do some stuff around recruitment intention. One of my favourites, Neil Eastwood, who is joining you, I think, at some point during this series. He's a guy that I've known for a while, and his book's fabulous, and his presentations are even better. And we meet up a lot at events and things, and I love the fact that there's people like that trying to make positive impact on people within it. But the truth is, over the next decade, we've got to try and employ another 650,000 people.
It's not a small number.
We know that's not going to happen. It isn't going to happen. So that comes with 2 things. We've got to make it really cool for people to stay.
Yep.
Make it really cool for people to want to come into it. Yep. And then we've got to find great technologies that means we don't need as many people. Yep. And not that mean that then care is diluted. and then trying to, it's really good. Sometimes you think to yourself, well, why are you doing this sector? Because it sounds like a real challenge, but that's why. Because I think it's got such great opportunities that impact people and us and all of us. It's going to affect all of our families at some point, in some layer. So I think that's really quite positive. So going down to that layer of like understanding and making sure it's a cool place to work. Because how bad is this? Another anecdote. How bad is this? That if you go to school at an academy and you don't do very well at your GCSEs, to some people that's O-levels, but GCSEs or whatever they're probably going to be called now, do you know what you get? Do you know what you have to do?
Absolutely no idea.
So if you don't do very well, they say do an adult social care MVQ.
What?
No, that's serious. This happens literally in probably 80% of the country. So what we're saying to young people is, you're not very clever, you're not very good at academics, which is absolutely not true, because we're seeing amazing things happening with young people that aren't related to school, because actually we're teaching them the wrong things. And if anybody follows Jack Ma from Alibaba in China, he's got great ideas around our education, around the world's education system, that we're actually teaching people the wrong things, but that's a completely different podcast. Where we're actually, we're saying to young people that actually you're promoting negativity on the sector from the age of 16, 17. So how are we going to recruit those people?
It comes back to that negative, the narrative, people's belief systems around how they perceive the outside world and how they look at things. And people look at the sector as a whole, and they don't see it as being a great place. They don't see it as being a cool place, somewhere that they want to go and work, somewhere where they're going to find fulfilment in their role, in their future, something that's going to give them the type of life that they want. And it's
there
really
is a
sad.
couple that are really trying it, and that's why, like I said, media content like this and media content like a lot of providers are doing really sort of focus on what people are doing within the home. There's a couple of groups that I've seen doing some amazing stuff, some video content, and then also when I speak to their team members about their passion for the sector and they're actually getting it out there in a wider sort of discussion, I think has really helped. And that's one of the reasons why I got involved in the Care Workers charity, because it was that vision for it long term to be not only about being a benevolent fund for care workers, which is focusing on the sort of the bad job in the 90s of in terms of pay. What was also going to focus on is how can we signpost, how can we be more proactive, and how can we make sure that we don't have that problem again.
Yeah.
And that's the bit why I got involved. A good friend of mine's the chair, and he asked me to come on board, and I said I'm really happy to become a trustee, but only if this is the bit that I can focus on. How can I help get things into the care sector to make it a cool place to work? How can we just re-educate and make it a cool place to work? And again, that's kind of the baton that we try and keep hitting. So going back from all of that little journey that I've just done there, it goes back to our values as our own business, is how can we make it a cool place to work? And obviously we're absolutely not perfect, and I'm not ever going to say that, but we drive and to try and be that place to make it a cool place to work. We try and offer development. We try and focus on how can we offer roles that people want to do. How can we make roles that maybe didn't exist? Because as a business, we need marketing, we need property, we need refurbishment, there's so many different facets to it that aren't just about being in the care portion of what you do. And you're finding that your employee focus is changing significantly from that. So
again, you've obviously invested time and energy into making sure that you've mapped out your values and that they're part of your operating system as an organisation, as a team. How important would you say having your values mapped out so that you've got that operating system is for your business, but then also for other people operating any type of care facility?
Well, one of the things I wrote in the book that I wrote talks about it, so I kind of have to, because I've got to keep myself honest. I'll be honest with you. Sometimes that is the way of doing it, because sometimes it's good. You can talk, but it's delivery, and sometimes you have to try and by putting things. I've always learned to put things out in the public domain. You keep yourself honest, because
absolutely.
People can challenge you on it, and that's great. But again, you have to have your own ways and means of doing it. I think it was important because one of the things that I found was, especially when our business model to date has always been put the purchase of retired assets or failing assets, so ones that are either inadequate, well, mainly inadequate in administration, because that's the kind of how we've had to do it, because it's, you know, you can't just go out there and borrow X amount of millions and build a swanky new care home. If people think it's easy, it's not. I've been trying for a while. So you can go through this process of where you're picking up. So I realised pretty early on that people thought I was mad, because I'd go into homes that hadn't had any of that. They'd never had that. They were single operated units that were just being totally, they were going to work for going to work's sake. So when you start talking about visions and values, they literally don't have any idea what you're talking about. And they do not buy into it, because people think, why are they talking to, why is Adam talking to me about these types of things? This is stuff that happens in London. Sure. You know, this is what that happens at like big organisations.
Or even I literally have no connection to what you're talking about whatsoever. So there's
Correct.
No context at all.
Correct. And that is the challenge, and that is what the sector struggles with. And I think you have to just push through it, and you have to go, no, it's even more important here than it is in, you know, corporate world. Because corporate world, it's done, you know, so they've got something to put on the wall.
Yeah,
it is.
And
but in this, it actually means something, because really, if you have that drive, they understand what the organisation is trying to do. Because it isn't about, you know, being the boss of a care organisation. It's actually about saying we, as a collective, are directly involved with trying to support a family and somebody else's wider life. And we're going to make mistakes as we do that, and we're going to do the wrong thing, and we're going to get pulled up on trying to do it this way, but I think if we have that mindset from the start, and we can try and get people to buy into it, then I think it bodes well. You know, we've had two really positive turnarounds. So we purchased 2 inadequate care homes in the last 10 months, and both of which have seen that change in that period. And I like to think that people have engaged with it, because we've had positive inspections, we've had positive retention, we've had positive recruitment, and we've started to see those sites turn a corner. They take a long time, and I don't recommend anybody do that. You know, try and do nearly 100 beds in 10 months of administrative, you know, in administration, inadequate assets has been a real challenge with a small business the size that we are. But I feel that going in there as me, saying this is why I do it and this is what I want to do it, and having them understand that it's not just about turning the you know, the lever to produce profit, has helped that become easier. So that's why I felt it's important to have embedded vision and values in what we try and do.
What you're doing there is you're designing your culture rather than having a culture by default, and I think that's where a lot of people struggle, in that they experience challenges within their business, within their care home business, and they see the problems. What they don't often have either the time or maybe even the inclination to look at is, okay, so what are the causes of the problem? So if we've got particularly high numbers of agency use, or we're struggling with occupancy, or if we're fill in the blank of whichever kind of dynamic that you might have within one of your homes, a lot of those challenges can be linked back to a cultural challenge. Because if you don't have values where people are, let's say specifically for you guys, okay, so you're a disruptive organisation. Say if you weren't interested in developing technology, and you had an issue in your business that was derived through the fact that you didn't have a technology supporting the type of outcome that you were looking to deliver, you would experience stress as the business owner. Your operations team and your management team would experience stress, because they're having to deal with maybe the frontline team experiencing what the challenges that they're facing. Without that operating model, without having created the context in which the way in which we work here, you're leaving yourself so open to people not showing up to work the way that they should do, because they're not aligned. They don't have that cohesive group of people, which is obviously you've had to undergo that significant transition times 2 over the comparatively recent amount of time.
Times 3 really, because when I first came in.
Of course, yeah. Okay, so
you know, I love my father dearly, but you know, his outlook was not the same. You know, he didn't have that sort of mindset. I suppose we've been really fortunate, again, going back to content, that it's drilled into you. You know, the concept of being dynamic and entrepreneurial is kind of now statutory. You know, if you want to do something, the world enables you to do that, and the world enables you to educate yourself on how to do that. And I don't, you know, it wasn't like that. I've come relatively late to it. You know, I'll never forget the moment where I was in my 20s and I was doing a relatively mundane account management role. I was in charge of a few people. I wasn't doing very well. I was doing okay. You know, money was hard to come by. Commission was hard to come by. And I'll never forget that moment. I stuck my card in a cash point and typed in, you know, insufficient funds with 2 weeks to go in a month. I was just like, what are you doing? Well, what's going on? But, you know, I think that you have a lot. You're guided a lot more now. You know, that was nearly 15 years ago, and now you're given a platform to learn and do things via content and things like this that enable you to go, actually, I can do that. I can believe in myself because other people have gone and do it. And I think so. From a younger age, you're more accepting of that, which has helped that sort of transition of growth and culture and saying things that people might actually go, okay, that makes sense.
So just to make sure I'm clear on what you're explaining there, so you've experienced some type of positive reinforcement because of the, let's say, the digital world, you've been able to educate yourself and to be able to give yourself a kind of a different perception of what's going on in the world and the opportunities that are in front of you.
100%.
Yeah.
100%. Yeah, 100%.
I'd attest to that as well. Again, I'm a content hungry person that's just focused on personal development and that for me and my team and all that type of stuff. And I think I can't think of an exact comparable example, but I felt in the bottom of the bucket before when times haven't been so good and stuff like that. And that was probably before I started being open-minded and thinking to myself, actually, no, I'm not going to accept where I am today. I want to be in a better place tomorrow.
Yeah, my biggest thing was I'd never really been into. I've probably stepped off a little bit, but one of the biggest things that I read, I started, you know, reading business psychology and stuff like that. But it was the first book that I read was called "Eat That Frog" by Brian Tracy, and that I still go back to elements of that very first book, and that was what made me go, I just don't want to be just a cog anymore. Whether I fail or whether I do anything right or whether I do anything positive, great. If I do, then fine. But at least I'm going to try and be in control of it. And my biggest problem personally was procrastination. And that's why that book was the perfect first book to read. I can't remember why I was given it. It was completely random. And it was really easy as well, because I'm hard to retain my attention span for too long, which is why audio works well for me. Yeah. I can't read big, thick book. I look at it and go, no. And I remember it being really small, and I remember reading it. And so it's now become a staple amongst my management team, that you have to read "Eat That Frog" by Brian Tracy. But yeah, anyway, sorry, I digress. But it was just something that I thought was worth telling. A
great book for anyone that procrastinates, and that's basically everyone. Just read the book. It'll take probably, I mean, it's not a long book, is it, as well?
Yeah, 140 pages.
It'll help re-engineer your brain in a way where, I know now, I live my life by a diary. I'm quite structured from, not necessarily for the whole day, because obviously things happen and you never know what's going to happen, but from 6 o'clock until probably about lunchtime, I know exactly what's going to happen in that period of time. And one of the most important things that I do once I've exercised and had some breakfast and all this type of stuff, like tier one priority, what's the one thing that you can do today that's going to have the biggest impact on the rest of your day? Right. And not just do you get to do that one thing that makes the biggest impact, also you get that dopamine hit of checking it off your list and thinking, oh, I can relax a little bit now.
And it's always the hardest one.
Oh, of course. Yeah,
it's always the hardest one, and that's the deal, really, isn't it? But I think we have this sort of mantra with our manager, because we have we always have our management meetings once a month. We always try and just bring something to it, and it still comes up every single time. Just remember that every single time you go in on a day, that you'll never get everything done. Just accept that. If we accept that before we've got in, we're okay. And that's the most important thing from that book, is you always think, I've got to get to it. Actually, you don't. Yeah, you know that there isn't any. You're never going to get everything done in a day, because there's always too much. You can always make a reason for there being too much. And I think it's about making sure that you know which is the things that you need to get done and the stuff that can wait.
Yeah.
I've got a task list that pops up on the side of my screen, and I think there's about 6 things in there that have been there for about a year. That's how important they were. But that's the point, isn't it? It's understanding that they're obviously not that important, but you decide to put them in your to-do list. As long as your important ones are getting ticked off, it's fine.
Exactly. Okay, so what we're talking about to a certain extent here is high performance. I'd love to know what your definition is of high performance.
No idea. I don't really know. I don't know. I'm saying because I wouldn't necessarily consider myself to be high performance at all. I consider lots of other people that I see around me as high performance. I mean, for me, it's I just have a clear idea of where I want to get to, and I hope that I get there one day. When I say high performance, I mean I try and be as organised and as direct and as I can possibly be, but yeah, I wouldn't. I don't know whether I consider myself. My diary probably looks like it's a high performance, but doesn't necessarily. I don't. It's a difficult one for me. I don't really know what the definition of high performance is, because I look at when you look at sort of legal professionals and you look at sort of high end, burning the midnight oil. They're in the office sort of like 6 a.m. and they're there till sort of midnight. That's definitely not me, because I genuinely believe in having a balance. I think I've learned the lessons of not having a balance and what it can do to your personal life, and I'm very clear in that I want to enable people to be able to do what they want to do within our organisation, and then it enables me to do what I want to do as well, because I think if I don't get that view when I'm outside, I find that very difficult to function.
Mm-hmm. I mean, I definitely think that you're high performance. I think there are going to be people out there that maybe they've achieved all sorts of other stuff, but doing a quite significant, let's call it, turnaround, ultimately of 3 homes, and then what you have planned for the future. Not many people could do that. So also as well, I think what you've just said there around finding that balance is really, really important as well, because my coach always says to me, sometimes you have to slow down to speed up, and whether that means another analogy from my coach, but whether that means in a business context, he calls it getting up in the helicopter, so looking contextually around what you're doing at the moment, or whether that's actually, you know what, I'm not going to do any work today. I'm going to focus on my health, or I'm going to go and focus on my family, or I'm going to go and do all this, because that will re-energize you to then be far more productive and effective in what you do on a day-to-day
basis. Very true. I mean, my week, if you're going into that sort of levels, my week is very flexed to be in that sort of way. I'll have days where I do 15, 16-hour days, and then I'll have days that I do 4. And that's because the 4 is the days that you step out of it. So no, I mean, I'm an absolute believer in a helicopter view. I mean, it's been a big mantra of mine. Before I got into this, it's kind of, I did consultancy work, and that was kind of where we focused on, which is where the elements of my book came from, because it was a lot of that context that we used to do with organisations, because they were high performance sales organisations, and it would be going in about getting them to think differently, and mainly about how they could ratchet what they were doing. So I suppose that maybe that's embedded, that I always feel like I have to step out, and I do that on a weekly basis. It was funny because somebody said to me, quite almost sarcastically, I think, but I didn't know how to take it. I think I'm a bit defensive. And he said to me, "Written any more books lately?" As if to say, how did you... And the same person has said to me, how did you get time? And I know I've come back to it a couple of times. How did you get time? And I was like, well, I was on a train for like 4 hours, 5 hours a week.
It's a lot of dead time otherwise, if I'm not going to be doing something creative.
There's only so much time I can look at Outlook, or Gmail, as we now use. There's only so much I can look at that. And I just wrote it. It took me 18 months, and it didn't feel that difficult. It felt an enjoyment, and that was kind of my step out. Because actually writing about some of the things was writing about things that I was going through within my business, and then actually fixing them from writing it. So it was an immensely therapeutic process in that. And that was why the book is very much... I don't know whether people, if they read it, would actually like it, because it's literally written as if I'm talking, which, there's a lot of waffle, and it disappears off in tangents, and it talks about Netflix, and it talks about Google, and it talks about Apple, and it talks about Jim Collins, and it talks about Eat That Frog. Probably it's kind of just a mash, but that was why, because maybe it was actually me offloading to try and get some sense of where I was going. So maybe that's what it was. And this was just before we were starting this journey that we're on now. A journey that I found incredibly difficult to get to where I want to get to, because obviously to get to where I want to get to, we're going to need funding, and to get to that funding, I need to raise it, and that's difficult. But also I need to raise it in a way that I'm happy with, because I wouldn't be happy with doing things in somebody else's view. I want to do it in my own way, and rightly or wrongly, I'll tell you let's come back in a decade, and I'll tell you whether we got it right or not. But we'll see. I'm sure we'll still know each other then, so that's fine.
Absolutely. Well, we'll probably still be churning out video content.
Oh, I hope so. I hope so.
Yeah.
That's the plan, isn't it? That's the plan.
Absolutely. You mentioned that the process of writing the book itself was actually quite cathartic. I think there's I can't remember who it was, somebody I know who wrote a book. They basically said that the process of writing their book enabled them to empty their brain effectively onto a page. Yeah. to free up new ideas. And also what it enabled them to do is to be able to solidify the ideas that they had, because sometimes you've got kind of a concept in your head and it can be a little bit of a jumble, and actually getting it down on paper, that enables you to have better quality thoughts, and enables you to it reinforces your worldview, and I think that's a really, really important thing to have. I think the people that have a strong worldview and they're able to kind of connect with their own real thoughts. This links back into kind of vision and values and all that type of stuff. I think it enables you to operate more effectively as an individual if you're more deeply connected with your ideas.
Yeah, definitely. I mean, I'm trying to think the best way of trying to put it, because I think because when I came to write it, I didn't write it for any reason. I wasn't trying to sell anything. And I wasn't trying to sell a service. I wasn't writing it for anybody to necessarily make any money. I wasn't writing it for the audience in which it was written for. I didn't really know. So there wasn't really any thought behind that bit. But it just got done. And so, yeah, I think that was probably very true in it, and it probably did do that. But I also think it made me realise that maybe I know it sounds a little bit, but maybe I knew a little bit more than I thought I did. Because sometimes you get people come in and they go, wow, this, you do it like this, do it like this. And I was like, yeah, I know that. And it gave me immense self-confidence, which is something I don't really have, which you probably wouldn't believe. I talk a lot, but I don't necessarily believe sometimes in that. I always go, oh, I need a sanity check, and is that right? But actually, I'm like, well, actually, you get a consultant to come in and tell us, like, yeah, I already knew that. Why didn't I just trust myself to deliver that? So that was quite a nice sort of thought process.
It's interesting that you say that you don't feel like you're particularly confident. Again, I'd externally, I would challenge that, but then equally as well, if I look at myself, one of the things that I've learned really quite recently is to be able to try and hold two different thoughts in your head at the same time, and that's if you're running a business, if you've got any type of role, and you almost need to have a way in which to talk to yourself, like your internal monologue, relevant to where you are. So I found out quite recently, there have been a couple of times where I thought, we're absolutely steaming ahead, this is wonderful, and then I've had my ass kicked by something bad that's happened, where there's been a deficit somewhere in my business, and it's come around to, and it's caused all sorts of different problems. And I'm sitting there thinking to myself, I can now reflect on the situation and think, actually, you know what, that was me being overconfident. I was speaking to myself in an overconfident fashion, and I've got to take responsibility. You've got to take extreme ownership for these things. I've got to take responsibility for that, and I enabled myself to talk to myself in a way that allowed me to be overconfident. Now I'm far more reflective, and I can look at myself and say, actually, you know what, you are doing really, really well, but you haven't made it yet. Like that's an unachievable thing to be able to do, and it encourages humility, having those two different types of perspectives in you.
Absolutely, and I think that's important in this sector because of what it is about.
Of course.
It's much, it's a humanist business that we're focusing on people, who are vulnerable the majority of the time, and therefore I think you need to have that to be able to be effective.
I completely agree. So within your role, you are a leader, and you wouldn't have done what you've managed to achieve so far, and what I have no doubt that you will achieve in the future, without having picked up some good leadership lessons over the years. What leadership lessons have you learned that have kind of had the biggest impact on you personally, and then also supporting your team, who are ultimately leading whichever part of the business that they're running for you?
Very good question. Communication is my absolute key. It's bitten me before. Is you can run away with all of these amazing things that you want to do, and one of my regional operations managers, she always says it because she just thinks that, oh, here he comes, he's going to put something else on the table now. But it's how you communicate that and making sure that what's here gets out. And that's one of the biggest things that I could say about being the important lesson in terms of leadership, is be a communicator, constantly communicating, no matter how mad it sounds. but make sure that people understand the reason in which that's a journey you're going on, and don't assume that everybody understands it, because you're the only person that really understands your own thoughts.
Yeah.
And that's come back to bite me many a time, and I still try and go back to it, but it doesn't necessarily mean that I've got it nailed. But communication is absolutely key, and in this sector even more so, because again, you're talking with sort of people coming from multiple backgrounds, people coming from multiple understandings, people who might have been in a, especially if you acquired a business that's been failing, they might have, they've might have never been used to being communicated at all. So I think that's something that's really been quite important, and making sure people understand that everyone's on the same level. Say hello, talk to people. That's where you get the most out of people. Mm-hmm. Be there when you need them. They'll be there for you when you need them. More often than not, obviously, it's never perfect, but I think that those are things that I've certainly learned from being it. And I made mistakes when I first started in management. I started managing people far too young. I had no idea what I was doing. I was 24 and everybody was older than me, and all I thought was that you just shout at people, because that's what I'd experienced.
Sure, yeah.
And then again, it came back around when I got older, and again I wrote about it in my book. Should be the drinking game, that's because I keep talking about it. Is that you need to find people that get that whole sort of idea, but you can't be expectant to people. You can't shout and throw things around glass offices and stuff. It just doesn't work, and I felt like that was the way. And I thought, if I then start that, I need to make people understand that I went through that and it didn't work, so they need to manage people differently. Because you have to manage people whether you like it or not. Everyone can't be in a big loving, because sadly you still need structure and direction. But it's about having the right structure and direction, and actually just if you've got a direction and people understand it, they understand the reasons of why you're trying to get there, then they understand the consequences behind failing to do that. And I think if you communicate that and then you understand the consequences, you find a very good balance. Then you don't really need to go into any other any other element, really. You reduce your issues around leadership.
The way that you've just described that, then, okay, so what it sounds like to me is that you're communicating, but you're communicating within the framework of your vision and values, and that's enabling you to have a decision-making tool effectively for you and your team to effectively deliver whatever it is you're looking to achieve, and having that high quality of communication, but again within that operating framework and things. That seems to be the thing that you kind of reading between the lines that seems
absolutely.
to have made the biggest impact.
Well, I use the analogy of a barge on a canal. I always use it when management sort of spiel, is because your direction is the fact that you're on the canal. You can't turn left, you can't turn right, because you're essentially going down this route. You can go one way or you can go the other way, and that's why you've got those challenges. And you've got your locks, which are the steps and the movement within that direction and that challenge. But that's the direction that you're going to go to, and the locks are just the steps and the changes in that, when people can't deviate from it, because that's where you have major issues. That's how I've always coined this analogy that I've always talked about.
I've never heard of that one, but I like it.
It's my own.
It's good. I might be quoting that one, Adam, just so that you know. But I'll make sure I reference you whenever I quote it.
Thank you. I appreciate that. I appreciate it. Yeah, but so that was kind of, I suppose that's where it is. It's making people understand that there is a clear direction. Like I said, it's not always perfect. Because if you think you're doing it perfectly, and hopefully it doesn't come across as sounding like that, you're doomed to failure then.
One of my best or favourite analogies for high performance is, it's not about doing everything right all the time. It's about being introspective and then being able to reflect on when you have failed, and creating a feedback loop so that you're always learning. I think in school teachers, it's a lot of the time that failure's a bad thing. You go and get out there in the big bad world, and actually, you know what, failure's a really, really good thing. And okay, so let's make sure that we close the loop on this and say, not just failing on the same things over and over again, because that's not good. Yeah. But when you do experience failure, that's an opportunity to learn and for you to develop as a person. Like, I bet the biggest things that you've experienced, the biggest improvements that you've seen in yourself, in your business, in your team, I bet that's all come about through something that's somewhere in between absolutely terrible and pretty frustrating has happened, and you've just kind of gone to yourself, hang on a minute, I need to check in with myself here and work out what I need to learn and to take myself to that next level. I know that's very much true of myself.
Yeah, absolutely. What happened last week? I'll be honest. I had an amazing week last week, and then Friday afternoon, something came through, and it was just great.
Curveball.
Yeah. It was one of those days where you just went, oh, brilliant. And but actually, it could have been avoided.
Mm-hmm. Learning lesson. Right
Absolutely.
there. Exactly.
And if you don't, if you don't think you're going to make mistakes, then you're in the wrong world.
Again, it comes back to humility, doesn't it? So, okay, so I've got 2 questions I'd like to be able to ask you before we wrap things up. 2 really, really important questions, because I think they're things that people will hopefully be able to yield great value from. But personally, what is the best piece of advice that you have ever received?
Awkward pause now, isn't it? I mean, I don't necessarily know that anybody has given me a piece of advice that I would say, like physically, somebody who I know has given me a piece of advice that I've received. But there's 2 things distinctly which I find really interesting that I wouldn't say necessarily advice, but things that have made me think very differently. Okay. One of those is around, I was employed by somebody, and he was very much a aggressive, combative individual that felt that everything that he did was correct, and I nicknamed him the Viking. And there's this sort of analogy of where there's a cliff edge with a hopefully you might be able to share it. It's cliff edge and plankerwood employee, and then the person best employee sort of on the plank with a gun being held to his head, saying, I don't know if you've seen that analogy. It's essentially, why are you cutting your nose to spite your face? And that was where, he was constantly up for, people leaving because they didn't follow his exact path of how he wanted to be. And that was a great lesson to learn. Great advice. Well, he didn't give me the advice, but the experience gave me the advice. That's not how to treat people, because actually you need people to buy in and allow people to make mistakes and allow people to do things. So I really saw that was a really, really great experience for me in terms of that. And I did get some advice from an operator not long ago, actually, which was quite funny. And it came up because obviously I'm a relatively small organisation at the moment in Paramount to others, but I know a relatively decent amount of people, and I have a decent voice, and I get to do things in the wider domain to try and make an influence. And he said, "You've made yourself look bigger than you actually are, haven't you?" And I said, "Yeah." And he said, "Yeah, that's what I did." And this is somebody who I look up to in 25 years in the sector, and so yeah, advice in terms of sometimes it's not about worrying too much about, if you think you've got something to say, then make yourself have that voice in this sector, and don't be afraid of it. I don't know whether they're advices from people, but they're lessons that I'd say that I've learned.
Important lessons as well. I think there's a lot that people can yield from both of those examples. So, no, thank you. Okay. And finally, if you had one piece of advice for somebody looking to make a positive impact on the care sector, what would that be?
Come in it for the right reasons. Absolutely understand what it is that you're coming into this sector for. And if it's to create income, don't do it. Because it has to be, this sector doesn't need that anymore. It needs people that are coming into it with a clear impression about what they're trying to change, and that they feel that their impact could create change. Because it's not going to be easy. It's not going to be easy to raise money. It's not going to be... But it is if you only want to do it for one reason. If you only want to do it for one specific reason, it could be seen as very easy. And I think that can be problematic for the wider sort of growth of what we're trying to do. And some of the things that we talked about, some of the things that I firmly believe in, I don't necessarily know. I don't necessarily know if you only come in it with one desire and think that that's an easy return. That worries me. And that's probably going to be controversial. People will listen to this and go, they'll have a response to it. My argument would be, well, there's a reason for that. You've got that response. I had this before, because you're going, again, just because I'm interested in my point, I challenge technology in the sector. We say about positive impact. I challenge technology a lot. Now, we're an operator that does not use electronic care planning. Why? Because I don't believe that what is on the market does what I think that it needs to do in the future, which means I'm going to have to change it. What's a massive impact on people that don't use technology is the introduction of technology. I've come from a technology background, I come from a software development background, I come from, in terms of telecoms, and only 15 to 20% of the softwares ever get used. I wrote my dissertation on user involvement, so I know what it's like when companies go out there and spend tens of thousands, up to tens of millions of pounds, which is my dissertation was written on a company that spent tens of million pounds on a system that they took out after 4 years. Why? Because the people that they were getting them to use didn't understand it. And it goes back to this wider sort of thing about positive impact, about how can we get the care sector to be one? How can we get people to advice? Don't come into it with something where you just think we're just going to throw it in there and we know that we can get it to work, because the sector doesn't need that. What it needs is something that we know that we can grow with, that we can develop and we can use. And I don't use it because I don't necessarily believe in 3 or 4 years' time I'm going to be using the same thing. And what I don't want is to have exponentially bigger organisation than I've got now and then have to change. And nobody has ever convinced me otherwise. So that goes back to whether you want to operate, whether you want to develop, whether you want to invest, whether you want to impact technology, whether you want to do that. Come into it for the right reasons. And I absolutely don't think that everybody does. And I wrote another article, about 2 years ago on exactly this. And it was published, and a particular technology company literally hounded me down, saying, how dare you get that published? How dare you? And I said, it worked then. Because the people who felt that to challenge me on it, that's what I wanted, because that's what I'm here for.
You realise this might happen again now? There might be some other. Either there's going to be some new business salespeople that are going to be getting in contact to say, "Okay,
I get enough
we do
anyway. I get enough as it is. It's not like I'm invisible on LinkedIn, is it? I just think that again, I think sometimes you have to make the decision of, do I want to put my head above the parapet or don't I? And if I love Gary V. Do you like Gary V? So literally everything he says is offensive to a proportion of people, but the people that he offends is normally the people that he's trying to count out anyway.
Yeah.
So let's do that. Let's make it a good place. I've probably tried 12 to 15 different versions of different types of software and technology, and not many of them stand up to the test. And I get challenged on, well, why didn't you sign the paperwork? And I'll go, well, I don't believe in it. I don't believe in that it's going to add value to the organisation in the future. But we have some really great technology within our organisation that have really made a massive difference. So I think it's just about finding that balance of getting people to work, going right back to the very beginning about this collaboration. I think the collaboration needs to not only be with the operation, but it also needs to be with that external support. It needs to be, how can we all collaborate together to make sure that we're doing something unique? And there absolutely are technology organisations out there that are being collaborative, and we're talking to them, and that's great. But saying about coming to it for the right reasons, I genuinely don't believe that everybody is.
And I guess that goes up all the way up through I hate the word hierarchy, but everyone from a frontline team member all the way through up to potentially to a CEO and things, and everything in between. If you're turning up just for a paycheck.
Oh God, absolutely. You're going to get that. You're never going to avoid that, because otherwise we're sitting here saying we're going to get perfect world.
Of course,
but I think it's also being realistic in the fact that we've got to look at where the sector is. It's still in elements on its knees. We need to really, how do we get people to think differently about it? How do we get people to engage differently with it? I think is really important questions, and I think we're certainly solving those with things that are happening, and it's really exciting to be part of the sector at the moment. I'm really glad that I know that I'm investing the next sort of 15 years of my life into it at least, and excited to what it's come out with. But I'm also pretty sure that I'm probably going to bother some people on the way, and I hope that people tell me that I'm wrong. I can't wait. I want people to tell me that I'm wrong. I want people to tell me, actually, no, we do this and we disagree with you. I say, brilliant, let's work together.
Yeah.
Let's do something. You tell me what I'm doing wrong, and that'll be amazing, because then I know that I'll get better as well.
So this is all part of the culture that you're designing within your own organisation and that you're leading at the moment, to be able to have an environment where it's actually okay to pull somebody up and say, hang on a minute, that's not right, or either that's wrong or that needs improvement, or just to challenge each other's ideas a little bit. I had it the other day with one of our friends. We were having a conversation and we were talking about something really, really specific, and I reckon 90% of the conversation that I had with him was he was challenging my thoughts on a particular subject. It wasn't because he didn't like what I was saying, it's because he wanted to test the the quality of my own thought process to make sure that what I was saying that I believed in, and that I had given enough had enough kind of internal monologue and enough thought around that if we were, because we were going to agree to work on a project together, if that was going to work together, he wanted to make sure that that was exactly going to be the right, that I'd given it the time and attention that it deserved. And it's important, because I don't think enough people have that in their armoury of part of their operating system as people. There are lots of opportunities to be able to improve yourself, and being able to challenge yourself and the people around you, I think, is probably one of the first places that people can start. If you're passive around these things, that's where you just leave yourself open to for far worse things to happen if you just say, oh, it's nothing to do with me, or I'm not going to challenge my own thought process on it. It's fine. It's right. I'll deal with it later.
Absolutely. And you know, even myself, I've done that in the past. Still, it's happened, but constantly being. And I think that's when we talked about right again near the beginning. We talked about there's kind of this wave of over the last certainly 12 to 18 months. I didn't see it much before, unless I just wasn't party to it. But I didn't see the type of sector-wide challenges that come, as in challenging from peers wanting to work together, even though we have similar, albeit maybe even competitive organisations, because actually there's a greater good focus on what we're trying to do. You know, I'd spend a lot more time with people who are in the sector, and we just talk about some of the things that we could do. We meet up, and the events seem to be, like I said, maybe it's just that I'm at a different stage in the sector than I was before. But there's part of me that doesn't think that. There's part of me that thinks it's just a different wave of people, or the fact that people who've been in the sector, there is a different culture to the way in which we're all interacting with each other. Like, there's some great events during the year, and every single one I meet a similar group of people, and we're all kind of trying to sort of piece together these things. And some of us I've come up with very, very similar ideas of like, oh, I wanted to do that. Oh, we were going to do that. Like, you know, podcast being a prime example where you and I sort of found a synergy in that, you know, I was looking at the same thing. And then I was talking to somebody the other day, one of the guys actually from a supplier, about creating this entrepreneurial club where we all get together and start talking. I was like, yeah, I've been talking to Simon Parker about that. And then this chap who I think you knew was also talking about it with some other people who we know. And then it was kind of a bit like, okay, so now we can get some traction, because it doesn't just become one person's idea, it becomes multiple ideas, and we'll all just kind of make it fit. And I think that is what creates real change. Look at this, you know, application, tech sector. Surely that type of thing happened about a decade ago, which is why we are where we are now. Hopefully we're at that bit now, and we just now in a decade will be where we want to be.
That would be super exciting, wouldn't it? If we're on a tipping point on the cusp of a whole world of kind of different level of collaboration, because within those conversations, within those, whether it be the events or whether it be a forum like this or however it comes together, it's helping people raise their game within the sector, helping people to support the sustainability of the sector, and ultimately making sure that vulnerable people get looked after. But that's not going to come about, and I know we've kind of alluded to it a few times, but that's not going to come about by doing the same things that we've been doing for however long. We need to open our eyes and open our minds to new ways of doing things.
Oh, absolutely. I think people are. So like I said, do what you've always done, get what you've always got.
Absolutely. Well, I think that's a great place for us to be able to go and wrap up, because that's a really, really good point to be able to make. So again, this is the beginning of a conversation. This certainly isn't finite. You and me will doubtless record many other podcasts in the future. So it's been an absolute pleasure. Thank you very much, sir.
Thanks, Rick.